Okay, so here we are, and as we said, Debbie's been wearing this appliance now for about 2 to 3 weeks, 2.5 weeks I believe it is, and she seems to be very, very, very stable in her stop, very stable, being very comfortable. So I want to record that relationship now. So once again, Debbie, just go ahead on your own. Tap, 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 tap. Now, even though I'm touching Debbie's chin, please understand, Debbie, am I putting any pressure on that chin at all or pushing?
No.
Sometimes patients will reflexively, when you want them to close, will, as we all know, will tend to almost intuitively want to bring their jaw forward, and oftentimes if that happens, just this is not a manipulation, this is not a forceful pushback, it's almost just a reminder to the patient to, don't stick your jaw forward, just relax and close. Okay, now David, what we're going to do, I'm going to use basically like a caulking gun. In this material I use a great material, Futar D. It is the most rigid of the elastomeric type impression materials, or actually bite registration materials. And it's been an excellent material. It's much harder even than our conventional blue mousse that most of us are familiar with. And it's been a very, very good product, very stable. It has no unpleasant taste. It's been a very nice product for us to take relationships with. And so what I'm going to do, Debbie, I'm going to take this and I'm actually going to squirt a little bit of this material on the top teeth here, on each side. I'm going to very gently have you close down. You're going to close and you're going to hold for about a minute.
Okay.
It's that simple, okay? So let's go ahead and do it here. Very easy. Okay, and then again, just on your own, go ahead and just tap, 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 tap. And go ahead and hold there. No, give me a squeeze real firmly, okay? Notice there's absolutely no sliding. It feels like a very solid stop, doesn't it? Any sense of tension or tenderness in the jaws at all? Any discomfort at all?
No.
Okay. Okay, hold right there for about a minute. And also, I can use and reference that mark that we made earlier to verify that she has in fact closed in the same spot as she was before. And that looks good. Okay, it's been about a minute now. Debbie, go ahead and open up. And again, we can see here our bite records here. Again, even though these are elastomeric and they are flexible, it is a very rigid material. And Terry, I'm going to go ahead and put these on the model. Go ahead and put these on. Let's see here. Here we go. Like that. And what we'll do now is we'll put we'll disinfect these. We'll take these back to the lab, and we'll make a little bit of a modification. As with any type of bite registration material, you'll notice when you go back to the lab that the detail, and here perhaps you could zoom in on that a little bit. Okay, the detail in these impressions or these bite registrations is extremely fine, and especially with Debbie, who has some wear and tear on her teeth. You can see these little concavities of the detail. If we were just to transfer these models, these are much more detailed than the models are. So one of the points we'll do when we take it back to the lab, we'll take this bite registration and really just leave the cuss tip, so to speak, just like we learned when we were in dental school. We want to have just enough to register, but not enough to pick up the detail, because that will really prevent these. If there's any inadequacies in the model, that won't properly seed in. So we'll take this back to the lab then, and we'll mount them up for Debbie.